My name is Nerissa Ko. I'm a neurointensivist and vascular neurologist, and I've had the privilege of working as the vice chair for the writing group responsible for the updated guidelines on aneurysmal subarachnoid hemorrhage.
I am a doctorate prepared acute care nurse practitioner. I have about 20 years of neuroscience and stroke background experience and really started in the neurocritical care environment. So I am really honored to have worked as part of this author group and to be able to share my knowledge into the guidelines and to have be here as a representative on nursing practice.
About 30% of aneurysmal subarachnoid hemorrhages will develop delayed cerebral ischemia, and it's most likely to come on through the early injury about day 4 to 14 after the initial hemorrhage.
And this is a really critical time for nursing assessment. We do have diagnostic tools, including things like transcranial Dopplers. This is something we expect our patients to be receiving on a regular basis throughout that early course of their stay with us. We also expect our patients to have advanced imaging when warranted, things like CT angiography or CT perfusion studies. It's important for nurses to know to be proactive about talking about changes in exam, understanding they may need to get their patients ready for advanced imaging or TCDs every day.
One of our most important clinical interventions for patients who are high risk to develop a delayed cerebral ischemia is to use elevated blood pressure and maintain euvolemia, especially if patients are starting to show focal neurological symptoms in the setting of vasospasm. However, it's important to know that prophylactic hemodynamic augmentation or raising the blood pressure preventatively has been shown to cause harm.
It is important to remember that we're going to start on day one nimodipine for our patients. And this is something that we expect each of our patients to be receiving on a daily basis. But nimodipine is a calcium channel blocker that we are administering to our patients during that vasospasm DCI period. We expect to be given up to day 21 post subarachnoid hemorrhage. So important that the nurses understand the indication for something like nimodipine, how long we give it, why we're giving it, monitoring blood pressure, and the importance of making sure we don't have exam changes as our patients' blood pressures may become lower and drop and have hypotension, and that's not altering their exams in any ways.